yes, you should be able to explain to others the different types of indicators that can be used for your programs or projects, and also identify ways to developing indicators. And by the end, you should be able to plan and design indicators for your program. Don't forget, in Module 2, what we have done is to be able to define our results levels, which, yes, in some sense might be objective, right? And we are going to be matching the each step of that on our causal pathway to the indicators. Either it's an activity indicator, outcome indicator, or output indicator, whichever one. So we will be discussing that, and we hope that, yes, we have a good ride in this. So in the next few minutes, I will be looking at what key indicators, what are indicators, how to develop relevant indicators, the types of indicators that we have, and also look at some criteria for assessing indicators. And lastly, I would complete the learning task for this module 3 with us. So we can look at, yeah, I mean, if time permits, we can look at different examples, and now we put in indicators for them. So what are indicators actually? Um, they are actually the measures of all your events, the behavioral changes, the objectives you have outlined in your result chain. So for example, this is what I mean. So this is what we did in Module 1, right? So they actually measure what you have added in here, right? So if you say, like, legislature acknowledges need for law that protects women, so the measure of it will then be our indicator. That is what it means. Um, if you say girl child are aware of how to be self-sustaining at the output stage, then how do we measure that? It is by using indicators, and it depends on the indicators that you have developed. If you say they are now improved livelihoods, what do you use to measure in your own term? Um, what would you use to measure that improved livelihoods is what we refer to as your indicator. So they are measures of all what you have in here, right? Um, and also measures of your activities. Yes, uh, if you say yes, you would have developed the toolkit. So in terms of numbers, how many? So is it in terms of numbers, proportions, and all? So that's what we mean by indicators. So how do you develop locally relevant indicators? Uh, it is, I mean, so one is that, yes, you can use pre-existing indicators where possible. Yeah, we've gotten such question like, oh, do we have time to develop? And you can actually ask yourself, how many of your programs or projects have you gone to meet with the beneficiaries and asked, like, oh, what does success means? What does improved livelihood means? What does strengthening dialogue mechanisms means? What does increasing the children with disabilities in basic education mean? What is the success? What would you see that you will now say, oh, we have increased the number of children with disabilities in basic education? Um, so what would we see to know that, oh, we have reduced corruption during public procurement? What do we need to see to show that, oh, we have increased participatory budgeting in the health sector? Um, what would we see to know that, oh, we have increased access to justice, to speedy justice for women? So think about all that. But basically, you can use pre-existing indicators where possible. Why? because there's a whole lot of programs that has been done. I mean, your program might not be new, but in terms of context, maybe it might be new. But note that in this ecosystem, there's a whole lot of organizations, civil society organizations that are doing almost the same thing that you're doing, but might not necessarily be in the geographical focus where you're focusing on. So that's where the need for pre-existing indicators comes from. And I will quickly say that there's a website, indicate.net, where you can find, I mean, what this NGO in Czech Republic has done is to create a repository for either it's a relief indicators or development indicators, whichever one, in any of this area, either it's food security, agriculture, wash, maternal. Think about it, good governance, they already have it. Just click on anyone and you will see some level of indicators. Look, local authorities responsiveness, satisfaction with local authorities. If it's good governance, that's what it means. And you can filter it by the type of indicator, right? Either it's impact, so these are impact level, either it's outcome, let's remove this, or it's only output related, so these are output related indicators. So I mean, so you can see what your output means here. I remember in module 2 we talked about awareness, we talked about acquired, so what they have learned, right? Learning. So think about using it in that format. So indicate.net is a very good website for you to actually look at the indicators. They have readily prepared indicators for you. Either it's for relief or it's for development indicators in that sense. So you can use, and also, I mean, if you look at strategy documents of UNDP, of UN OCHA, you might actually stumble on indicators. Also, that some organizations have repository of indicators that you can also use. And also might be important for you to look inside the classroom. We have also put in some indicators there for you, some documents that have indicators that have been done with stakeholders and all, could be useful for your program as well. Secondly, you can partner with organizations that work in the same populations. So if you're working in Goronyo, if you're working in Ekpe, for example, if you're working in any part, any locality, your geographical location, think about other organizations that are working in that space. In you developing indicators, you might just ask for, yes, the indicators they use for their program maybe 2 years ago, and they should be able to reach out and give you. And also for you too, you can also share with other partner organizations, not necessarily partner, but organizations that does the same thing, and might be a way for you to create that partnership, right? So think about that. So here it becomes participatory. Um, you can decide to speak with, yes, the market women, if you're focusing on market women, and ask them what success looks like. Um, the children with disabilities, right? They have a group. People living with disabilities have a group. If your work is focused on that, then you need to bring them together and ascertain and agree on indicators, what success means for each of the level of your program. It's very important. You can involve stakeholders and knowledgeable colleagues, I mean, maybe experts in the area or people that have worked in that space before. It's important. If you're working with government, for instance, trying to strengthen dialogue mechanisms on participatory budgeting in the health sector, you can decide to talk to people working in the Federal Ministry of Health, for example. Like, so what do we think knowledge will mean? So, I mean, one activity you can also think about for your programs, indicator design workshops. It's also important. People do it, and that's where you bring your stakeholders, beneficiaries, knowledgeable people to come and discuss your indicators. And lastly, you can involve local researchers as well, sociologists, because they have their own idea. They might want to contribute to what you might think your indicators for your program should be. Um, so what are the types of indicators that we can have? So I mean, there are two types of indicators. It's either it's a numerical indicator or it's a non-numerical indicator. Not numerical indicators are used when, yes, you're dealing with quantity of a type of response, right? And what this does is it allows you to know the scope of your program, number of participants, um, the number of a particular group within your workshop. So the number of sexually abused women that attended your workshop, the number of government officials that participated in your program, which is supposed to change and influence the behavior of government, right? It allows you to understand, yes, the number of people living with disabilities in your program. And it can be expressed in terms of counts, rates, proportions, averages, and all. So this is what numerical indicators does for you and gives you. So there are different types of them you can think about. And like I said, you can have them in counts. Counts means, yes, number. So you talk about number of radio advertisements, number of legislators that have attended your program, number of youth programs that promoted um, um, promoted, yes, I mean, comprehensive relationship, how to relate with women, how to relate with the girl child, uh, number of acts that you have produced, number of condensed laws that you have provided to people. Think about all that. They are in terms of count. Then rates. What are the number of women that have been beaten by their partner per 100 pregnant clinic patients? So these are the rates, right? Because the rates measures, so it has two things it looks at: number of ads, content per number of ads per year. So like in a year, how many media organization has been able to run ads about stigmatization of women, about corruption in the public sector, about corruption, petty corruption in the education system. So you can also think about percentage, because your indicators comes in forms of percentages also, right? So percentage of clients that say X, Y, Z have changed. Percentage of women in your program that said yes, they talked to their husband about using contraceptives. Percentage of teachers that are in your program that use your toolkit to train young men or young women. You could have it in that proportion of men to women in your program who says they will continue to prevent violence against women. Um, Percentage of government institution officials in your program that said that when they get to their working place, they will make sure they put in systems that will reduce corruption during procurement. Think about all this. These are samples of indicators. Average, it could be in terms of average, right? So the average number, the average age of women who are sexually abused that are in your program, the average score of participants in your program before compared to after your program finishes. These are all types of numerical indicators, and they are expressed in counts, rate, percentages, and average. Let's look at non-numerical indicators. Yes, this we use to explain complex social concepts, right? Like like the rape case, right? Very complex. Like irregular migrants. So this is also complex. Drug abuse is a complex social concept. So you might not necessarily be able to attribute numbers, but what you can do is actually collect perceptions of this set of people and their experience, maybe in your program or after your program. And what non-numerical indicators allow you to know is the how and why things are working or not working in your program. So very, very important. And most times we use non-numerical indicators at the from the outcome stage at times, and the out, so mainly used for the result level, right? You can check in with your program also as well, and think about where you can have non-numerical indicators. Most times we always forget to include them, and they can be expressed in terms of codes, typologies, themes, case studies, as well. So in terms of category, think about existence of laws, existence of trained extension workers, existence of um, program participants that can step down the trainings you have provided for schools or um, for for lawyers or for public defenders. Quotes and testimonies. Yes, when you get quotes from your program, this is important, and I think it's one of the easiest things to do, to interview a program participant and get quotes from them, and also what we call testimonies about certain things your program has addressed. Perceptions of young men over women in your group, perception of different groups within your program. Very, very important for you. Then think about, yeah, perception of people, perception of some key things within your program. And you can think about case studies of different groups that have participated in your program. These are the types of indicators that we have, and you can make use of them. We've said it. If you look at indicate.net, it gives you a robust um, types of indicators that you can have. So in putting together your indicators, you might need to consider some things, like it must be something measurable. So for instance, if you look at these two, compare these two um, indicators: consumers feeling about network of Airtel Nigeria, and the percentage of respondents who mentioned that they have experienced no drop call rates in the last quarter or in the last month. 2 is preferable to 1 because you can actually measure out of your respondents those that mentioned that, oh, we did not experience call rates in the last quarter, right? Than measuring feelings. So think about your instruments that you will use, and now you put your indicators, percentage of respondents in your program that is saying that, oh, they have used the toolkits that you provided 3 times or more than 5 times in a month. Think about that as a good measurable indicator. You must be practical, right? Um, for instance, look at these two. Number of targeted girls who understand their basic human rights. This is too bogus, right? It is too generic. But think about, because that's why we use percentages, right? You can think of percentage of of sexually exploited ladies, percentage of uh, children with disability who now understand the basic rights, or exploited women who now understand their basic rights, percentage of um, government officials in your group that now understands the Procurement Act. So things like that, percentage of public defenders that now understand um, how to record statements. So that is practical, other than having a generic one where you need a census data, right? It must also be reliable. Reliability means that you are using the right measurement. Number of deaths that occurred in primary health care is not the right measurement. Rather, the mortality rate at the APHC in the last month is ideal for you to use, right? So using the right measurement and not minimum deaths, or the number of deaths, is very, very important. It's good for it to be relevant to your program. Um, For example, if your program is trying to create child learning centers or study centers in different communities, it is better to use change in access to that girl child learning center, right? Than saying it in a generic format like having access to learning education or so. But it must be relevant to your program, to what you're providing, right? Also think about its usefulness to your management, because don't forget M&E is used to improve your program, right? So your management needs to look at indicators. You need to report indicators that management can be comfortable with. And on that note, look at these three statements. So this is a question for you to answer in the comment box. Out of these three, which one do you think is useful and sensitive for management to take action? Out of these three. So put in the comment box what you can say about these three indicators, and which one do you think is preferable for your management to use. So answer that question in the comment box of the classroom, and we would have a discussion about that. Needs to be responsive as well, which means, yes, um, instead of you saying the percentage of SMEs that are performing, because you would ask, what does performance mean? It's better for you to say percentage of SMEs that are adding more than 50 jobs in a quarter, right? Instead of you saying the percentage of CBOs that are performing or that are doing community mobilization, you can say that the percentage of civil society, community-based organizations in your program that are adding more community-based groups that are conducting mobilizations, more than 20 mobilizations in a quarter. Instead of you saying percentage of CBOs that are performing or that are working, you say the percentage of community-based organizations that are conducting more than 20 community mobilizations in a quarter, or writing over 100 petitions in a quarter. With that, you are being more, your indicator is becoming more responsive to the work that you're doing. So that these are what indicators are like, and that's the way you coin them. Don't forget, they are measures of the events, activities, and occurrences, behaviors that you have actually designed and proposed in your theory of change, because it is the indices for you to measure. And if you do not measure, you cannot know where your program is. So they are indices, and they're very important. And we have two types of it, the non-numerical and the numerical indicator. The numerical ones are those that are put together in form of numbers, averages, ratios, counts, while the non-numerical ones, which deals with complex systems and all, uses typologies, codes, um, uses categories and the rest that we have shown us in some of these examples. And in developing your indicators, it's important that you think about using pre-existing indicators where possible. That is where possible. Most importantly is to engage beneficiaries that will be part of your program. Very, very important. Or look at organizations that have done the same thing in the area that you're working on. And this leads us to the learning task that you're supposed to actually do. And this learning task is from your module 2, right? In module 2, you have been able to develop a course pathway, right? Um, Yes, you have tried developing your cursor pathway. So now we'll be looking at you putting in indicators for each of what you have at every stage of your results. So that is what we will be doing in this um, learning task for module 3. So you can see how the learning task progresses right from module 1. Same you're going to get till module 7. So it's very important that you pick one program from learning task 2 and you continue with that. The references, if you want to read more about indicators, we've already provided some guide documents also in the classroom. So think of useful websites. I mean, I've mentioned Indicate here, and there are other ones you can look at as well. So maybe we should just quickly look at our learning task, which is this. And don't forget, you can get that in the classroom, which is here. So it's module 3 learning task. Just let's view the assignment for module 3. Then you click here and work on this template. So this is the template you will see. What you just need to do is just for you to copy what you already have in here. You don't need to do a new one, please. Just copy what you have done for module 2, then put it in module 3, and you put in the indicators for each one. So I'll be working on this. I have this just for training purposes, because I focused on improved livelihoods, right? For exploited women, I can think about my indicators from here. Don't forget, this ID is for us to be able to identify and be able to make suggestions for you. So not necessarily like, so for this, I will just say, so for instance, for activities, I can say so that's I 1.0, right? I 2.0, I 3.0. So I mean, you can go on and do that, right? No, I want 4.0, or I mean, in whatever way you can decide to put that together, it's fine. I 5.0. Then when you come here, you can decide to IOT. So that's indicator of an output 1.0, right? Indicator of an output 2.0. So this can be I, right? So capital I. Then this also I, output 3.0. So I mean, so this I can use to quickly define, oh, IoT, right? Then my outcome, which I will use O for, outcome 1, outcome 2, boom, outcome 3. Most times you just have two outcomes, right? And not necessarily three. But this is just for training purposes, right? I won't go to indicator for impact. It's the larger part of things, but um, so um, for monitoring purposes, you need monitoring indicator, right? Yes, for monitoring activities, you need that. So, meetings with legislatives, I would say, may, number of meetings, right? Number of meetings, advocacy. Yeah, number of advocacy meetings, uh, yeah, number of school clubs, or then road sensitization, road sensitization. So number of road sensitization carried out. Just think about number of toolkits. These can be average hours of training, right? So I'm just using this so for training purposes, um, right? So you have that, and at the output stage, remember we already said this, so let me put this as IoT 4.0. So how do we know that legislatures acknowledges need for law that protects women? That's what our indicators will be. Child are aware of how to be self-sustaining. So you can think, so this is where you now need to put in your thinking cap about your program, right? Um, um, so you could so you could say change in knowledge, right? Of exploited women on sexual abuse reporting mechanisms. I can recoin this and say the ratio of change in knowledge. I could say um, Yeah, change in knowledge of ratio, change in knowledge of exploited women versus women within within our activity, or that attended our trainings, right? That could be it. More exploited women learn about dangers of irregular migration, right? I could say um, ratio of exploited women to women who haven't, to other women in our program who said they now understand dangers of irregular migration, right? So, I mean, all these are done with your team, right? So, not necessarily something you do on your own, but I mean, you facilitate it as an M&E person. Legislator acknowledges need for law that protects women. This could just be quotes from legislators during advocacy meetings. Don't forget, you already said you will do advocacy meetings, right? With legislatures, state legislatures. So, I mean, you can see that all your indicators here are within the scope of your program. So, you need to think about that carefully, and that is how your activities result to your output, right? And not something out of your activities. So more girl child are aware. So um, you could say um, average number of girls in attending school clubs that responds they they can now start businesses. For example, so I mean, it is something like that, right? Um, then if you now move, you can see that here we've used a non-numerical, and while all this, so this is also non-numerical. I mean, this is also non-numerical. This is numerical. This is numerical indicator. Then you now come to the output stage. There's a law protecting women, maybe. So existence of XYZ law. You can think about the VAP Act, right? Something like, you can just say any act, anyways. Improved livelihoods. I mean, if you time it as increased businesses. So, I mean, this will also be number of women in, oh, let's do this. Change in the number of women that started business, number of women in your program that started businesses, right? Um, so they are within. I mean, if you have 200 women in your maybe, I mean, not all can start. Maybe a few of them. Um, so then reduce trafficking, right? Um, so this you can also can actually be non-numerical. So you could say perception of stakeholders on the rate of trafficking of women, right? Or yeah, I mean, and if is the remember that this is a tough goal. You can think about, yeah, there's also the sexually abused, which means yes, maybe reduce sexual abuse might be, so you think about perception of stakeholders on that as well. um, you could see that mostly at my result stage, yes, I become to use not necessarily numerical but non-numerical, but also that which we'll explain in week 2, that you can actually report numerical indicator from this non-numerical. Possibly, it's actually possible. So this is what this is all about. So don't forget, you have your ID and you have your indicators. Um, think about another, I mean, think about another program whose goal is to reduce, is to, let's assume, strengthen participatory budgeting, for example. Strengthen participatory budgeting in the area of health sector, right? That's the project goal. That might be a project goal. Let me see if I can, because I still have some time. So project goal, um, increase budget participatory budget in uh, what state can we use now? In Sokoto state. Um, so your objectives, project objectives, is how do we, or project objectives is how do we now achieve this, right? Um, could be strengthening collaboration between CBOs that are focused on health budget, right? Increase knowledge around health budget amongst focus professional groups. You could also think about improve dialogue mechanisms between stakeholders in the health sector. This project might be one way to also narrow this down. Let's say in 3 LGAs, in real life, the resources we have might not cover that, might not cover for the whole Sokoto state, right? So this might be then you can now think about um, several assumptions. Let me not go into, let me just stay with activities, outputs, outcomes, then impact at some point will be, yes, participatory budgeting. Established, right? So let's look at some of our activities. If we have some time, we can still look at that. Let me do this. So we have a results statement, right? We would have our, just for descriptive purposes, I'm not going to put the IDs and all. So, but each of these will have their own activities, right? And I'm just going to use that. Train CBOs, right? On health budget tracking. Let me pick one activity from here. Develop health budgeting manual, right? Dialogue mechanisms. Organize town hall meetings. So I'm just going to focus on those three, and let me just insert one above. So yeah, in training CBOs, become aware of how to track, become aware of tracking, budget tracking methodologies. Uh, knowledge around, right? Health budgets, develop health budgeting manual. Who are these people? Professional groups. Yeah. Health budget cycle. Right. Let's look at the third one. Town hall meetings to foster dialogue mechanisms, right? Um, increase collaborations among stakeholders. I hope I've not. Yeah, so you can think about your outcome, which is so when CBOs have increased knowledge about that, let's see, what will they do? What will their change in behavior be? Maybe CBOs increase mobilization on participatory budgeting. Let's not forget that this is about so participatory. The assumption is that yes, they do not understand how to do this right, and also here, or do not know the advantage of that. And also assumption is that yes, staffs also or those facilitators understand what participatory budgeting means as well. CBOs increase mobilization. Um, More partnerships are created. Between CBOs and LGAs, right? So I'm going to stop there and go to indicators also. I mean, all these yes, numbers of health, number of average hours contributed to trainings. That's a numerical. Uh, Number of manuals distributed. Town hall meetings, right? Organized town hall meetings. Yes, number of town hall meetings. So you use this to monitor your activities, right? If you also do maybe radio programs, yes, you need to the number of radio programs, and at the output stage will be number of you can think about uh, average number of call-ins per program as an output indicator. CBOs become so I could say change in knowledge of CBOs in here. Ratio of professional groups within the program that said they understand increased their knowledge on participatory budgeting has increased number of partnerships or cases. Let's use cases of partnerships between CBOs and LGAs. Yep. Oh. Increased collaboration. Oh. So this, I had a jump. I thought I've reached there already. Increased collaborations among, we can think of number of joint working groups, for example, or existence of, let's not say number, existence of joint working groups, or whatever you time it, people working together. Anyways, CBOs increase mobilization on participatory budgeting, right? This you could think of, what can we use to measure that? We could also on participatory budgeting. One long-term outcome could be participatory budgeting being tested. So you can say existence of or cases of so in here would be mobilizations per quarter, right? So that's another way to take a look at it. Yes, and boom, that's it. We have looked at two examples critically, and you can make use of that in your learning task. I mean, yes, you can come up with different ideas for depending on your project objective. So we look forward to receiving your learning tasks. In summary, just to summarize this, yes, we've looked at indicators, types of indicators, how you can develop it locally, and we have also been able to develop appropriate indicators for two different programs. So we look forward to your submission on each of these of your learning task for week 1. My name remains Oludotunbabayemi, and I will see you all in week 2, and also see you in the classroom where we'll be chatting and responding to your questions. Bye for now.